I had my last of 3 BCG Cancer immunotherapy appointments this morning, and I'm feeling pretty crappy. I feel like I have the flu. I'm having a little trouble, like just breathing. It feels like allergies. It feels like flu. I just feel like I have somebody sitting on my chest. The bladder urgency, the urination hasn't been too bad. I've had some burning, but I'm taking aspirin, so it's really not too bad. But the burning would kind of get worse through the day. But this one out of the 3 that I've just had is a little bit more high impact than the other 2. So I've reported my findings on my other ones. So if you check back on my TikTok videos, you can see some of my other comparisons on my other ones. But I thought since I was taking this time to kind of sit here and be sick, then I could explain to everybody a lot of stuff I'm always talking about. I thought I'd get a little more in depth on what made me choose the BCG immunotherapy for what my doctor actually recommended to me. I didn't really have much of a choice. When I asked him, what if the BCG doesn't work, he said there are no other things that he can do. So my doctor's just a certain way, and as always, check with your doctor and see what their schedules are. But here's the website if you want to go check out the study, which I recommend if you're getting into this. The study is actually very self-explanatory. You got to skip through a lot, but just look at it as a layman. I had non-muscle invasive bladder cancer, or NMIBC, and here's some of my findings. With my schedule, I had my surgery last year, and then after that healed, he had 6 initial treatments of BCG. That was 6 weeks, 1 a week. And then 3 follow-up treatments every 6 months after that, or twice a year, for 3 entire years. So I had my 6 in January. I just now, it's August, had another 3. I just did the last one of those 3. And then I'm off until the turn of the year, and then I'll have 3 more. And you do that for 3 years. So I'll be done with immunotherapy in 2026, right? It's about the end of 2026. So I got some time. When you go in, they put a numbing agent in your urethra, and it acts also as a lubricant for the catheter. So they insert it, they put it in, the agent in, they remove the catheter, and then the whole thing takes about 15 minutes. It is not a long procedure, and hopefully you get a skilled nurse, of which I have. She's done it for a really long time, and the more I do it, this was number 9 for me. I'm used to it now, if there is such a thing. It isn't pleasant, but you do in fact get used to it. So afterwards, you gotta hold it in there, of course. And I come home, and then for 1 hour, you turn on each side for every 15 minutes. You In order to coat the bladder, that's what they ask you to do. They gave me a handout and told me to do all this. Your doctor may ask you to do something different. They may have you do it in the office, but I come home and do it. After that's done, you can freely go to the bathroom and flush your bladder with water for 2 hours. And every time you go to the bathroom, you got to pour bleach in the toilet to kind of contain that biohazard, let it sit, and then flush. Some of the side effects that I've had through the whole thing, I'm not really having all of them right now. I do not have a headache, though sometimes headaches come and go. Scratchy throat, fatigue, tiredness, flu or allergy type symptoms, urinary urgency and frequency, urethra pain and burning, bladder spasms, bladder pain. I'm not having any bladder spasms or bladder pain, but that is not uncommon. I've had that through this whole ordeal. The urethra pain, I'm taking some aspirin right now. I do recommend that. Take some Tylenol or something if you can to just help with the pain a little bit. And you're going to have some urgency and frequency for a while. I've been having the treatments every week for the last 3 weeks. So basically, you're going to the bathroom for that whole time. So don't smoke, kids. But this... Now, here's just a general definition that I wanted to throw out there. A type of cancer treatment that uses a patient's immune system to help fight cancer. Just to keep it very simple and leave it at that. So, on this particular study that's offered to us, it goes all the way back here. You can see to the number of patients is 60 in 1985. This is the gentleman's or lady's name who conducted it. and they did the schedule of the 6 weeks. So as you can see here, the 1 year reoccurrence in the patients and the percentage of 3 out of 6 with the BCG had recurrent cancer, and 4 out of 6 had recurrent cancer that did not have BCG. So you can see about 50% when they did the 6 weeks. But to make a long story short, and you go through and do your own research, check this all out, by the time you get all the way down to the end of it, it was the very last study in 2021, which is very recent, makes me feel very lucky again, that using the medication that I get, is Tice, by, I forget, the company's Merck, weekly times greater 2 or equal than 5, the induction plus 2 maintenance. This is exactly what my doctor does for me. The induction is 6 and then 2 maintenance. So that drops the percentages here to 9%. So if you go all the way to the top, and if you read through this, they'll further exemplify it, but you're looking at 50% here for sure. But once you really get into it, by the time they did it in 2011, they knocked down to 27% recurrence of tumors, 28% recurrence of tumor, and then they figure out something here, and I think it was the maintenance. They drove 20 to 8. So when you read the study, generally, if you do the BCG and it works on you and it's effective, you have decreased your odds from 75% to 9% of recurring tumors in non-muscle invasive bladder cancer. So that is great, and that's actually what steered me towards definitely getting this type of therapy. My doctor told me that it filled me in on as much as he could about it, and I didn't really want to do any research on it, because when I had active cancer and when I didn't know if I was going to die or not, it really sucked to go and look at studies like this. But some of the finer points of this study, check it out, read the whole thing. You don't understand 90% of it, because I really don't either. But current management of NMIBC, non-muscle invasive bladder cancer, involves initial complete resection accomplished via transurethral resection of bladder tumor. That's TURBT. And for those of you that haven't had it or don't know, TURBT, transurethral resection of bladder tumor, that's just a very complicated way of saying cutting the tumor out of your bladder. Post-operative surveillance without post-resection therapy, without the BCG, the cancer recurs in 50 to 70. This is where I get those numbers from. 50 to 70% without BCG for patients with non-muscle invasive bladder cancer. Okay. So that takes it down to, you saw in the last study, was 8%. 5-year recurrence of recurrence-free survival, RFS, 80%. So that is great. So what you're looking at is the 5-year survival and 5-year recurrence of tumors. That is an absolutely great statistic. If you happen to fall under non-muscle invasive bladder cancer, it looks like high or intermediate or low risk, and it works on you, then this is just great. It seems to me that the full 6-week induction course results in the RFS of 25 to 74%, and then the maintenance therapy 28%. So with these things added up, you have to do the 6-week induction in order to get the efficacy. So with the risks, very briefly, it's all in here. Read it, please, to see the risk. Side effects, dysuria, which I'm not sure what that is actually, but that seems like frequent urination. Urinary frequency, urinary urgency. There could be a presence of a bacterial thing, they say. Maybe this thing could create an infection, so always watch out and pay attention to your bodies and make 100% sure you're being healthy. But when you look into this, they say that these are treatable, and that they're I don't want to say they're rare, but they're not like this huge determining factor in BCG. So there you go, everybody. That's the layman way of explaining that. Good luck to everybody, and I hope this helped a few people.